Hi, my name is Dr. Ecker of Alegheny Physical Medicine. I'm a doctor of chiropractic. Today's discussion will be about the hip. There's all kind of various hip problems and conditions that can occur that I treat very successfully at Alegheny Physical Medicine. If you take a look at the general anatomy of the hip, you have the ilium, and then you have the ball and socket, which is this is part of the femur. And then right here where you have the ball and socket, that's where the arthritis occurs. And then you have ligaments and you have musculature that comes crosses the joint. So you can have various muscles that can cause pain. You could have a hip pointer, you could have a strain of the hamstring, the quadriceps, and those muscles cross that joint and the hip. And then you also have musculature in the back, and then you also have it in the front. You have the ilium on each side, you have the sacrum, and down below is the coccyx. And then you have the nerves that come out of the spine, and you can see that if the muscle tightens up or if there's injury to that area, then you're going to have some pain that can go down into the front of the leg, out into the lateral aspect of the hip area and into the groin. A lot of times, however, if there's a sacroiliac problem, which is the sacrum and the ilium, that can cause pain into the groin area as well. But through a thorough interview, whenever you ask the patient the questions and go through a proper examination, we're able to make the determination of which condition is occurring. From that point, what I normally do is, if there is a misalignment in the hip, which a lot of times there are, I perform a chiropractic adjustment to the hip or to the ilium, wherever the patient is needed. And then following that, we go through specific stretching and strengthening exercises to improve the hip function. That's why chiropractic has a lot of success treating the hip. The interesting point about this hip stuff is a lot of people think that they have hip pain, meanwhile they're having sacroiliac pain because they're pointing right here, like right to the lateral aspect of the hip, and they think that that's the hip. But the true hip would be more straight into the front of right above the leg. This is where the true hip is, and that leads us into the area that a lot of times, if you treat these muscles, a lot of times people say, well, I have a TFL problem, or down below it becomes the iliotibial band, and we treat that area as well through chiropractic treatments, trigger point therapy, and exercise. But a couple quick things that we have the patient do to find out, determine if it is a true hip problem is we have them raise their leg. You can raise your leg, and then if they have a lower back pain, we know it's coming from the lower back, or from the hip, or from the sacroiliac in the back. And then a quick way to determine it is, and we check the muscle strength of the patient, have them raise their leg. They can push down and then raise up, and then we can determine which area is a major complaint. And then just a quick simple test is you just have them lay the leg out to the side, and you can do this at home. And if you have pain in through here, the hip area, then you know that there's some type of maybe hip osteoarthritis, or there's a hip dysfunction, and through chiropractic adjustments, we can help that problem. And that concludes our condition of the hip, and next week we'll talk about the knee.